Everyone, welcome to Medic Talks with Health and More. I am Dr. Rebecca Okolo and I'll be your host today. Today we'll be speaking with Dr. Uju Rapu. She's a medical doctor, a cosmetic expert, and she's also the managing director of Belfiore Medical. So please stay with us as I add that to the video. Together we'll be talking about skincare for a busy medic. I've sent a request to Dr. Uju and she'll be joining us shortly. During the course of the video, if you have any question regarding your skin and skincare, please just type them in. We'll be taking your questions. Hello, Dr. Uju.
Hi, hello everyone. Good evening. How are you?
I'm good, thank you. Nice to have you.
Nice to be with you this evening.
Yes. So, Dr. Uju, let's get to know you. Can you tell us a bit about you and your medicals?
Okay, so I'm a medical doctor. I specialize in a field I like to call aesthetic medicine. So aesthetic medicine covers skincare, treatment of acne, hyperpigmentation, anything cosmetic related. And I also perform non-surgical cosmetic procedures. So I do a lot of treatments for people who come with cosmetic concerns. I have black spots, or I have acne, and I treat with prescription products. So I'm very into cosmetic products. And then, of course, I perform cosmetic procedures that don't involve surgery. So things like non-surgical lipo, treating of smile lines with fillers, anti-aging treatments, lots of injectables. That's what I do. But skincare is a part of it as well, because obviously that's under cosmetic.
Wow, you do a lot. Okay, one more. We're waiting for people to join us. If you have joined the video, if you have any question, Dr. Uju will be answering all your questions. So just type them out one after the other. We'll read them and they will answer. So Dr. Uju, can you tell us why you were attracted to dermatology?
So I find I've always been into more like the cosmetic aspects of medicine. So I practice in a hospital, but I'd always notice, oh, this person, they're losing their edges, or they have stretch marks here, or they have black spots. So I noticed I was always picking out cosmetic things. But obviously I'm a medical doctor, so I'm thinking, and it's not just skin, it's also sort of fixing people's bodies, fixing their faces non-surgically. So it was a bit tricky because not many people are doing that, obviously, in terms of who to look up to. So went abroad for a period, and aesthetics, procedures, anti-aging, a lot of people are into that. So did training in that, learned some procedures. Obviously, when you're passionate about something, you're reading lots of things up about it, practicing on yourself. So really just threw myself into that about 2 years ago. Moved back, worked in an aesthetic clinic with another doctor who does similar for a period of time, and then just felt I wanted to sort of do my own practice. So I just find I'm quite passionate about aesthetics and how people look, because I feel a lot in medicine, people sort of take these things for granted, like there's nothing wrong with you, but really how you look is really going to affect how you feel, which will affect how you relate to people around you and how, you act in your daily life. So I find it's something that is really important to a lot of people. So that's how I got into cosmetic medicine, and basically skincare. And I'm currently studying for a diploma in dermatology as well. So it's not 100% clinical dermatology, but then cosmetic dermatology, more like, so anything bothering your skin, acne, breakouts, pimples, black spots, sunburn, wrinkles, how to stop features of aging appearing too soon. That's my specialty.
Okay, we have a question from NBR.mine. What's the reason for acne on the forehead and what's the treatment?
Okay, so acne is a chronic condition. Chronic means it's long-term. So we don't say that we cure acne, but we manage it. So I normally go over with my clients what causes acne, and then we find we can usually treat it that way when we know what causes it. So we have little pores on our skin, and you'd find that for some people, they come in just certain areas, and it really means what areas you have more hair follicles. So what happens is your little follicles, like little holes in the skin, they get blocked. Typically, they should let out oil, let out sweat, cleanse the skin. But then some people will find they're blocked. Why? Some people aren't washing their skin properly. So I go through, how do you wash your face? Some people acne around the forehead sometimes is also due to really thick products you're putting on your hair that might be blocking your scalp and affecting the forehead as well. So I ask what you're using on your hair. make sure you're washing your face at least twice a day. When the pores get blocked, you have bacteria on the skin that is there normally, but then it's suddenly blocked in your pores. You have oil, other things that would naturally want to come out of the skin. They're suddenly stuck there, and they're irritating the skin, and you have a little big pimple. You pick it, it's a black spot. So treatment involves making sure the pores are not blocked, which we do with proper cleansing techniques. So you're washing your face at least twice a day. I normally like to tell people to exfoliate their skin. If it's either using scrubs once in a while or chemical exfoliation, which some products will put you on to just keep dead cells off the skin. We treat, because there's so many things happening with acne, people usually have oily skin, there's usually dead cells, usually dirt. I just basically put you on products that have ingredients treating all the areas. I put them on products that are exfoliating the skin, make sure they're washing their skin properly. One thing people don't realize, they always say, is this something I'm eating? There's a very strong link with dairy products and acne. So anyone that's prone to acne, stop milk, anything from a cow's milk, yogurt, cheese, and you find usually sustainable improvement. Where if acne is a constant problem, I definitely say see a specialist, because just getting rid of some things you're doing in your normal lifestyle would help. So not putting anything oily on your face, not using harsh products, cleansing the face gently, and then we can usually put you on some other cosmetic products with antibiotics, little things that help, basically.
That's really good. We have a question from Temi Toyo Ide. What procedures for skin tests do you offer?
So I find in terms of the skin conditions we see, and people say, can you test and let me know what my skin is likely to have later? People normally, usually is my skin oily, dry, or combination. And it's more, you can usually tell. So people that have oily skin, you'd find halfway through the day you're dabbing or your nose and taking off oil. I tell people like that, just stay off oily products. So don't add anything oily to the skin. If you're using a moisturizer, make sure it's a water-based or oil-free moisturizer. Some makeup brands are oily, which can make that worse and make you more prone to acne. So things like MAC is an oily-based product, which is okay for people with dry skin, or people that have oily skin, not so much, can make you more prone to things like acne. People that have dry skin, you can usually tell. Look closely, their skin, it looks a little bit scaly, it looks a bit dry, so tell them to moisturize a little bit more. But when you say skin tests, it's more people come in with their concerns, and then we find we don't really need to just be throwing tests up and down, just doing some. It's usually, this is my problem, and then with these things we can sort of just observe and let you know what your skin is likely to be. But in terms of testing, we never really have to do.
Okay.
Yeah.
Okay. All right, now let's get into what we really want to talk about, which is the skincare for busy medics. Medics all the time. Some of us get up early, we are on call, we don't have time to take care. So what skincare routine do you recommend for a very busy medic?
I think my main challenge as a medic was, which now look, it was like a no-no, was sleeping with makeup on, because you're on call. And for me, I wanted to look nice during my call. So I keep my makeup on, and then you go and lie down. You're literally just sleeping with this heavy layer that you've had on through the day in a hospital with bacteria, with everything you've picked up. So I'd say another thing as a medic is, obviously you don't want to spend all your money on skincare. So at that stage, you're not really trying to go and throw all your coins to really expensive brands. But the most important thing I'd say is to have a face wash. So just keep that in your bag, a nice face wash. People use soaps to wash their face, which I don't like. Bar soaps tend to dry out the skin, so we prefer something that says face wash. So you wash your face at least twice a day, and a sunscreen every morning. That's really the basics everyone should be on. So washing your face morning and night, and a sunscreen in the morning. So those are definitely the basics. But if you now have concerns, conditions, and that's when we will now take you into another level of treatment.
I chip in something for people watching. Okay.
Yeah.
We're going to take your question. I just want to say something. Personally, as you said, I really had a lot of issues with my skin growing up. Like, I had crazy acne. Crazy. I used everything from Dr. Mura to Neutrogena. I even tried remedies that I made by myself. But for some weeks now, I found out something very useful. Like, sometimes it's stressful for you to go to the sink, wash your face, and do so many things. I found out that having a hand towel is really, really helpful. Like, when you wash your face over the sink, just have one hand towel and use that to clean your face. Like after rubbing the cream, just squeeze the towel, wet it, then clean your face. It saves you a lot of time. So you can actually end up washing your face, masking your face, and you don't have to always pour the whole water and wet yourself, wet the whole place. Just keep using the towel. And
but when you use the towel, what are you using to wash your face, or you're just using the water?
No, I use cleanser. Okay, like when I use Neutrogena. Yeah, I use Neutrogena.
Okay, you're using the cleanser. Yeah.
After using
another thing I find is just having wipes. So wipes are very easy. You can have wipes in your bag, and even if you're already in bed, you can't bother to stand up, just take out a wipe, clean the makeup off, and you go to bed. So that's another good one, actually.
Very good. Yes, wipes. Those are the short cuts. Like when you're on call and you can't maybe get to water, you are very uncomfortable. At least have some wipes in your bag to help you.
Yeah, I think wipes is a good one.
I'm going to take Semi Toyo's question now. She said, for example, I have irritations on my arms, neck, face, and back, and they can't trace the allergies. My question means, what procedures can I do to check what?
Oh, I see. Okay. So there's something called a skin patch test. I think they'd be able to offer it in some diagnostic centers. Usually people that have irritations, they want to make sure you're not reacting to something you're using. So what a skin patch test involves, I don't do this in my clinic, but they'd have this in some diagnostic centers. They should do. They would come, it's about a 3 to 5 day procedure, and they'd ask you to bring in most of the things. Well, you do a long history. What are you using? Any new products you're using? What are you eating? I would always take milk out of your diet. Dairy products. A lot of people react in terms of skin to dairy products. I take that out. And a lot of people, things like fragrance. So your question is, how do I know what it is I'm reacting to? So people that offer this test, they tell you to bring in everything you're using on your body. They put a little tray, like a little plastic tray on your back, and they put a little bit of each product that you're using. So a bit of your deodorant, a bit of your cream, a bit of your perfume, and leave it on your back. It's quite, it's a bit tedious because you won't be allowed to wash that area for at least 3 days. So they read after about 48 to 72 hours, you come back in and they look at the area on your back to see where had a reaction. So that's currently the gold standard diagnostic test for I'm allergic to something, I don't know what it is. It's called a skin patch test. So wherever you are, I think you can probably look that up and maybe call a few diagnostic centers to ask if they offer that. Otherwise, so they basically just look at what you're reacting to on your skin by putting it directly and covering it up. But you won't be able to wash that area for about 3 days. Otherwise, I would really say just simplify your whatever you're using as much as you can. So just put yourself on basics. If it's a Dove is quite gentle. Dove soap, shea butter, coconut oil, something just very bland. Watch what you're eating.
When I had bad acne, I went to see a skincare doctor, and she told me, stop everything you're using. I was like, huh? Stop everything? That means you want my face to be destroyed with these pimples? No way, I'm not stopping. But there was a time I was bold enough and I stopped using everything. I was using just Neutrogena. Like, I've used everything. I've used Dermalogica. I've tried everything. But I found out that sticking to just one simple routine helps your face. I wasn't even using a toner. I was using just a cleanser. Just cleansing, that was all. No extra. I wasn't scrubbing. I wasn't doing so much on my face.
Just doing your simple routine.
A skincare expert tells you stop using everything. You're like, that will not work for me. It will work for you. You just have to be patient.
And I feel people that have acne, they're sort of always jumping in between products, because the funny thing with acne is when you're on products that are actually meant to treat, usually it gets worse before it gets better. And you need to sort of give yourself at least 6 weeks to see results from any products. So people will try for 2 weeks. It's getting worse, throw it away, do something else. You're not giving your skin enough time to adapt to anything you're using.
Irritating the skin even further. Okay, Miss Keaton has a question. I don't do anything special to my skin, specifically my face, but I've noticed that I have 1 to 2 pimples on my face during my period, usually large too. So my question is there a way to avoid that?
So the number one cause of acne is hormonal changes in the body, which means because our hormones are always sort of doing up and down, I can never tell you're not going to have a pimple at all. So we know stopping dairy products helps in hormonal acne, but as women especially, you have period, menopause, pregnancy, even things like stress can cause a spike in certain hormones. So you're always, in which case it would make you a bit more prone. The thing with preventing that is if you're on some good products. So products that have a bit of salicylic acid. Most of the acne face washes would normally, salicylic acid basically just keeps dead cells off the skin. So we're using an acne product, not like acne intense treatment, but something a bit gentle that's sort of helping the skin a little bit. It might prevent, but I can't tell you you're never going to have a pimple again. But the thing is, we now don't want the pimple to leave a spot. So pimples can come and go, but we now don't want pimple then to leave bad scarring. So it's important, we find using sunscreen to prevent any darkening. So most people that have pimples, they pick, it leaves a black.
Because I've used some sunscreens in the past and they really turn me off because they look your face.
Yeah, so I'll tell you about sunscreens, but we cannot say you're never going to have a pimple again, but using acne products can sometimes help a little bit. And then I say don't pick and use a sunscreen, and it prevents the pimple leaving a mark, which is harder to treat. Sunscreens, I feel sunscreens were initially made with white skin in mind. So a lot of people were like, oh, I don't need to use a sunscreen, I'm black, whatever. But we find that skin is skin. We just have more pigmentation in our skin. We know the sun's rays do two main things in all people, all types of skin. One, they speed up aging. So the sun's rays break down collagen in the skin. Collagen tightens the skin. When you're breaking down collagen, you're more likely to start seeing lines, wrinkles. So the sun's rays speed up the aging process in everybody's skin type. Second thing, the sun's rays make you more prone to pigmentation. So a lot of people are like, my face is darker than my body. And you suddenly think that's normal, but it's not. Any area that's constantly in the sun will get darker over time. So that's where a sunscreen comes in. A sunscreen is a lotion, a product you apply onto the skin that stops the sun's rays going into the skin. Most people's complaints with sunscreen is making me, what do you say it was making you do?
It was very oily, left my face really oily.
Yeah. So with sunscreen, there's a wide range of sunscreens available. I find people who only use a sunscreen they are happy with. So I normally tell you, coming, is your skin oily or dry? It's oily. I'm not going to put you on an oily sunscreen. I'm going to put you on a water-based sunscreen. So there's lots of sunscreens made with different things.
The creams, the BBCC creams are like the best right now.
Yeah.
Is that right?
I tend, because with most of the procedures I do, one risk is that if I do a chemical peel on you, for example, and you go outside, you can get darker. So I'm very particular with my sunscreens. So in terms of my people coming in to do treatments, I normally recommend them a sunscreen, sort of medical grade sunscreen. But if you're looking for a sunscreen, look for an SPF 30 minimum. I don't usually like the ones in makeup because really you're not wearing makeup every day of your life, and sunscreen should be used every day. So people find, so you're only using the makeup when you want to go out. You're only using sunscreen when you're going out. So I'd say look for a sunscreen that's SPF 30 minimum. So shouldn't be, and most of the makeup brands will now be SPF 15, 25. We know that it's recommended to be in a 30 minimum to actually have good effect. If you're able to test the sunscreen to make sure it blends in, once you find a sunscreen that blends in, you're happy. So people who have more complaints, if I have a range, so I would normally let you test. So if you tell me you have oily skin, you have dry skin, I usually recommend one of the ones I have. But there's some good sunscreens out there. Just make sure it's a 30 minimum. If you're able to test it, obviously that helps. Okay. And then you want something that's not oily if you have oily skin.
Okay. Winifred Mora has a question. What to do about that pigmentation on my first, mostly under the eye? She has
mostly under the eye. So pigmentation, we need to know what is causing it. We need to know what's causing something before I treat it. I'm not going to start treating something because if you know what's causing it, you'll be getting worse. Pigment under the eye. So the skin under the eye is very thin. We find that as we get older, skin under your eye just starts to thin even more. Under the eye has lots of blood vessels. Blood vessels are like little pipes that carry blood. So blood is like a dark red color. So most people that are getting, so this is one cause, most people that are getting older, as the skin here starts to get a bit thinner, you find the blood vessels are closer to the surface, so they're showing a little bit more, and that area looks a little bit darker. How do we treat that? We put you on eye products that have collagen or vitamin C to try and thicken up the skin there, and then prevent the skin aging faster by using a sunscreen. Secondly, people that have allergies are prone to having darkness under here because when they're always rubbing on their skin. Anywhere you're constantly putting pressure on the skin can come out a bit darker. So you find elbows, knees, anywhere that there's constant pressure can be a bit darker. In which case, if that's you, be conscious of, doing that a lot. Thirdly, in terms of dark under eyes, some people have hollow under eyes, which just happens as we're aging and can be genetic as well, meaning there's a hollow under your eyes. It just like you have this, like, I have a bit of a hollow under my eyes. And it casts a bit of a shadow, which makes that area appear darker. in which case my treatment for that is fillers. So a filler is an injection, like an injection made of a gel called hyaluronic acid used to fill volumes. I just fill out the hollow under and it brings it up. So it's really about finding what might be the cause. So I'd always do a consultation. Are you rubbing your eyes? Are you sleeping well? Does anyone else in your family have dark circles? Try and prevent with a sunscreen, some nice eye products that are encouraging thickening of the skin. And then if it's something we find your eyes are so hollow, then we can bring in our little needles to help.
That's good. Thank you. Miss Keaton said, my legs are darker than my face. In fact, my skin has patches. How can I blend them all together?
My question would be, because with pigmentation, there's so many things that cause pigment. So people that have pigment, except you were born with it didn't usually just come there. So people that tend to have dark patches, light patches, I normally ask them what they been using on their skin. A lot of products these days are mixing things in that can be lightening some areas. A lot of the mixed creams. I don't know what you're using, so I would typically say, what are you using? So if you want to answer that, or if you have using any creams that have been mixed, or any unbranded products. A lot of the products designed to lighten skin, you'd find they're lightening the skin, but they're making the skin prone.
Miss Keaton says she has
you not use any. You just have patches.
Yes, you just grew up.
You just grew up with. Was it there when you were born, or you sort of just always had?
You just grew up with it. Yes, I guess maybe from childhood.
So pigmentation in that case can be hormonal. So some people find they're just more prone to having pigment, but I definitely say be conscious of the products you are using. The sun's rays darken us. So you find any area that's constantly in the sun, your arms, and let's say you're always wearing a short sleeve, this way will be darker, the face will be darker. So a sunscreen normally would help prevent it worsening. You've had it from childhood. Some people that have pigment from childhood or they're born with it, they're usually a little bit trickier to treat because we can't usually pinpoint to exactly what caused it. But I would say at this point, bring in a sunscreen, and then I can usually give you a product that can exfoliate the skin. So some body products that have like lactic acid, low doses of glycolic acid, they exfoliate. So exfoliation takes off pigment that's already there. So we're trying to take off that, the pigment in certain areas, and then we use a sunscreen to prevent it getting worse. If it's something you've had since childhood, it might be I'm not sure how long, but that's a bit trickier.
Let's say at least yes, she should be at least 20.
Sorry, should have at least 20 years. Yes. It usually makes it a bit trickier for us to pinpoint what caused it, in which case if you think it's something that everyone noticed when you were a child, I'd probably say go and see a dermatologist in a hospital to just rule out anything else.
Okay. And for Dr. Jenny, she said, would you also recommend the SPF 30 for dark skin?
Everybody should be on an SPF. So the difference between a dark skin person and a light skin person, we all have melanin in us. Melanin protects us from the sun. Mm-hmm. So melanin acts like a natural sun filter, meaning you find that me compared to maybe a Caucasian person, I already have a bit of sun filter naturally in my skin. But we know that the sun's rays cause darkening. So my face will be getting darker if I don't use the sunscreen. And the sun's rays also speed up aging. So we want to just use effective sunscreen in everybody. Because I'm dark, you're fairer than me, but you find 20 years down the line without me not using a sunscreen, my skin is going to still get darker. My face will be darker than my body, which I don't want. So everyone should be an SPF 30. But people that are darker tend to already have more protection. So we're a little bit luckier. People that have more melanin. So hold on to your melanin.
All right. Then NVRB mindset. My friend don't use any face wash or soap. Still she faces some rashes, causing too much irritation on her face. I want to know the reason.
So like you said, rashes could usually signal irritation, which you've noticed yourself. So it's really to find out what's irritating her skin. So when you say she doesn't use any face wash, she's not using anything on her face at all. So I basically go through.
Maybe.
Sorry?
The pillow. Maybe the pillowcase needs to be changed.
So another thing, exactly. So another thing, there's something called atopic dermatitis, which is basically people are prone to just having irritation. They don't know what is causing it, so they can't really pinpoint. Anyone that has a dermatitis, we find that dry skin is the hallmark of dermatitis. So there's a lot of things that could cause this rash or irritation, but if you have a rash, you see a doctor, we can usually prescribe a cream anti-inflammatory cream to bring it down. Moisturizing the skin often, if it is a dermatitis, will prevent you getting that rash more often. So dermatitis is something that we manage. If it is a dermatitis, we can't completely cure it. You may have flares once here and again, but we just try to prevent the flares with constant moisturizing. And when you do have flares, we can put you on a light steroid cream to calm down the rashes a little bit. And then also to pay attention of things around you, plants, animals. It's not worth really doing. It's difficult to find out what causes the dermatitis in people, because I get it as well. So we just try to prevent flares with lots of moisturizing. When you get the flares, we give you something to bring them down a little bit, and then pay attention to what you're putting on your skin as well.
Okay. Dr. Jenny is asking, how often can I exfoliate ash dark skin?
Exfoliation can be done 2 to 3 times a week. So exfoliation can be, you're using mechanical exfoliation, so a little scrub. So you do it very gently. I don't tell people to use sponge and do that, because we don't want to traumatize black skin as well. We find traumatizing the skin makes you more prone as well to pigmentation. So using a nice scrub at least 2 to 3 times a week. And then we also have chemical exfoliation, where we can do products like glycolic acid, lactic acid in chemical peels, which I do. I put you on products that they don't have stones, but they have these little acids that just exfoliate the skin gently and evenly, in which case those are usually safe to do like every day. So there's lots of types of exfoliation, but you can exfoliate 2 to 3 times a week.
Okay. And from Miss Keaton, SPF 30, is that a product name or something scientific in the product?
So sunscreens are rated based on something called SPF, which is basically their sun protection factor. It just means how effective is this sunscreen in preventing the rays entering my skin. So every sunscreen will say SPF 10, SPF 30, SPF 50. We know that it is recommended to be an SPF 30 minimum. So the SPF 30 just means it's a rating given to the sunscreen to tell us how effective it is in protecting us from the sun. The difference between a 30, because I know they go up to 100, and a 50 is about 2%. So once you're in a 30, we're okay. So anything that's a sunscreen will always have an SPF with a number. Yeah.
Okay. Thank you for everyone. Thank you to everyone leaving questions for us. Please type them quickly. We'll also be rounding up. So please, let's get the questions in so we can get them all the answers. Now, Winifred Mora is asking, okay, thanks. Are glutathione pills advisable for skin lightening? If yes, which would you recommend with no negative side effects?
Okay, so glutathione is a product produced in our body naturally. So I'll tell you how, because we do use it for skin lightening. It's made as an antioxidant to protect your body from damage, like vitamin C. Mm-hmm. We have found that high levels of glutathione get the body not to produce as much pigment. So in an area like mine, where people are conscious about their looks and aesthetics, that's why it comes in for skin lightening. The level needed to lighten the skin is high. It's a very high dose. So in terms of skin lightening, skin brightening, I do injections, glutathione injections, high dose injections, with vitamin C. So I said it tells the skin not to produce as much pigment. But someone like me that is already pigmented, you also want to get off the pigment. So we do exfoliating procedures as well. Then you want to stop the pigments coming back, so you do sunscreen and sun avoidance. Most of the glutathione pills, the dose is not high enough to give you a visible skin lightening. They're usually giving you the antioxidant, nice vitamins. They usually come like 500 milligrams or so. The dose I'm giving you straight into your blood. And another thing with the tablets is that you take tablets, you're not getting 100% of a tablet into your blood. You're going to get some into your pee, you'll sweat some out, you're excreting it naturally. So the tablets are not usually sufficient to lighten skin. People that want to lighten their skin, because we also live in a hot country, most of us, the sun is always trying to darken us. So we're trying to stop you getting darker. So you're on a sunscreen, I'm putting you on exfoliating products, I'm injecting you with glutathione and vitamin C 2 times a week. And you're conscious about sun avoidance. So it's safe. It's safe if you know who is doing it. A lot of people are selling injectables on the internet. I don't recommend that. So I say go to someone who knows where they're getting the products from. So basically, the pills will not be strong enough to lighten. They're really giving you nice antioxidant vitamin effects. But in terms of skin lightening, using glutathione, it takes a little bit longer, a bit more effort, but it's nice and safe if done correctly. So I don't use the pills alone for skin lightening. They're not strong enough. The dose is too tiny.
Okay, and one more question from NVRB Mind. How can I get rid of blackheads from from how can I get rid of blackheads from the nose and its nearby areas on the face?
So blackheads, I'm not. So you're talking about blackheads, not black spots, right? That's what I'm going to talk about. Blackhead is an indication of a clogged pore. So how your pores get clogged, first it starts with a white head, which are usually very, very tiny or invisible, just a little white bit sticking out. A white head exposed to the sun eventually becomes a blackhead. So in terms of getting rid of blackheads, are you exfoliating your skin? You need to exfoliate your skin because it basically means your pores are getting clogged. So people go for facials and they have them literally empty out the pores, which is okay. But with facials, be careful don't let them scar you. Some people scar when they come out from facials. So it probably means you're not exfoliating your skin as well as you should. So get a nice exfoliator 2 to 3 times a week. So a blackhead is basically just a clogged pore. And then what you're putting on your skin, oily products, heavy makeup can also clog the pores a little bit as well.
Okay. Miss Keaton has a question. You spoke about armpits. I really hate mine. It doesn't matter what I shave with. I usually break out with bumps and the hair grows back quickly. What's the best product to use?
Bumps in areas that grow hair, usually called a folliculitis. If you're a dark skinned person, we find the hair comes out and it goes back inside and it irritates and it forms a little inflammation, a little bump. I would normally say which we can't help, just genetically, that's how we grow hair. So sometimes we modify your shaving practices, it can help. So another thing, when you have bumps, sometimes people are using the same razor, they're not cleaning it properly, the razor is carrying bacteria, they go back again, the bacteria now infects and it forms a little bump with a bit of pus in it, which is a tiny infection in the skin. So changing shaving practices helps, in which case I prefer the one-use razors, so use and throw away. Or, because I mentioned friction can make pigmentation worse, so using a good shaving gel, so you're not just sort of shaving on dry or shaving just on water, use a nice shaving gel, or the cream hair removals can help as well. In terms of, so we find just modifying shaving practices a little bit as well. If you don't want any hair there at all, I do offer permanent hair removal as well, so we can do electrolysis and just get the hair out completely, and you don't have that problem. But usually changing your shaving practices would help a little bit.
What about waxing?
Waxing is okay as well. Waxing is fine. It's better than waxing is okay. So some people, we find it's really to find what works for you. But the no is basically just using the same razor over and over again without friction. But yeah, waxing can work. So we need to try it and see what works for you.
Yeah, Miss Keaton is saying, get hair out completely. So I think this.
So that's definitely an option.
I've left the Belfiore Medical. Belfiore _medical, BELFIORE _medical. Just drop her a DM. You see her address on her profile, so you can go there and get the electrolysis. Okay. That question from Dr. Jenny. Do I use the sunscreen before or after my regular body cream? Or can
That's a very good question.
Especially when I go out.
Yeah, I'm sorry I missed that. So the sun's rays penetrate clouds, meaning sunscreen on a rainy day. Penetrate windows, meaning once you have a window in your house, you should use sunscreen. We can layer products, but sunscreen should always be the last thing you use. Okay. So between you and so you can do your wash, your moisturizer, whatever, and then use the sunscreen on top. Then you can use your makeup on top. I like to say sunscreen should be used every day. So just brush your teeth, put on your sunscreen, make it part of your daily routine. Obviously, it's worse when you go out. So people that are complaining about pigmentation problems, lines, wrinkles, I don't want to age, use sunscreen every day. Just make it part of your routine. So something you're happy with can be in your moisturizer, SPF 30. Just rub it on every day and go. Yeah.
Okay, that's good. Phoenix Emancipated said, do you treat keloids on the chest?
Keloids can be treated with either surgery, which I don't do, or steroid injections, which you'd have that done in the hospital. So I don't treat keloids, but your options for treatment are surgery and steroid injections. If you go to a clinical dermatologist in the hospital, they should be able to do that for you there. So I don't treat keloids.
Okay. Hello, it's me, Puran Dakad. This question, I don't think it's for you, but he said, say about chemotherapy.
Chemotherapy? You mean for cancer?
That's what I'm thinking. This is not about cancer, it's about skincare. So that will be for a cancer expert. All right. So far, there are no more questions. I actually made a list of questions, but
Okay.
I spent today. So if
Mhm.
anybody else has a question, yes, if anybody else has a question, please quickly leave them. I'm going to ask you one of my own questions. So what makes Delphia different from other skincare clinics?
I'm very passionate about, because I feel like a lot of other clinics are just trying to get you in and get you out the door. Some people come, I don't want people to ever think that their concerns are not valid. So people can come in with the tiniest concern, tiniest cosmetic concern, a bump here, a spot here, a wrinkle here, and I take these things very seriously because I'm so passionate about the work I do. So I'd say what makes me different is probably, you can tell I'm not just doing it because I'm really passionate about it, and I take people's concerns very seriously. I do whatever I can do to make sure I correct or make you happy enough when you leave. Obviously, because of skincare, most doctors who are doing skincare are just doing skincare. So I'm really covering everything aesthetic, everything cosmetic. So I do non-surgical lipo, which is for areas of stubborn fat. I do chemical peels, I do collagen induction treatments, I do vitamin injections, vitamin drips, I do non-surgical facelifts. I do lots of treatments to basically reverse features of aging. So I'm focusing on the skin because it's aesthetic as well, but I also focus a lot on everything cosmetic, so stretch marks. So I'd say I think it's a nice one-stop cosmetic clinic. So, and obviously I'm a doctor as well, so I'm coming from a professional aspect, but making sure we're able to keep you looking good.
Okay. There's a question from Sapphire Steph. I once bought a sunscreen and it was so thick and chalky. Is that how sunscreens are?
Not all sunscreens are like that. So we have two types of sunscreens. Sunscreens can be physical sunscreens or chemical sunscreens. Physical sunscreens are usually those thick white ones. They tend to be just a film against the sun. Very effective, but very unfriendly to skin of color, especially. So people don't really like those ones. Chemical sunscreens, they've now brought little ingredients that basically just take the sun's rays and scatter it. So we find, if you look behind the sunscreen label, things that have octacillate, or they usually start with OCT. I won't remember everything now, but the titanium dioxide and zinc oxide are physical ones. Most sunscreens will tell you, if you look in the ingredients, they'll have a list. So I don't know, some people look these things up. So go and check the sunscreen and see what is in it and the percentage, because I can probably predict which one will come out a little bit whiter. The physical ones, the ones that make you white, are effective, but in small quantities, they're okay, they won't be white. But if you see a titanium dioxide 13%, it will be white on your skin. So not all sunscreens are like that. So I tend to source more of the chemical sunscreens. They're blending a lot nicer in the skin. So I think maybe if you're getting it by yourself, look up online sunscreens, which one blending well. I don't know what country you're at. I know a few that do blending nicely. They sell. You can probably order online. So really just do your research before going, because you don't want to go and buy something, open it, and it's not blending your skin. So not all sunscreens are like that.
Okay. There's another question from Miss Keaton. Is the hair affordable at Belfiore? And she also added something. She said, "Don't say affordable is relative."
So interestingly, the hair removal service is a new treatment we're just about to offer from March. So we haven't set the prices yet, but if you're coming early, then hopefully you'll be in our beginners batch. So it's a treatment we're starting from about 1st of March. So we haven't really set that yet. But if you message us, I can give you a costing average of what it would come to. If you send us a message on our Instagram page, Belfiore_medical.
So Miss Keaton, send a DM, okay? So from Sophie,
send us a message.
Yes, Sophie Necker, how much will it cost me to get rid of stretch marks on my arms?
In terms of the costing, if you're able to send us a DM or call the number on our page for inquiries, then we can give you a bit more information on the costing, because it depends on sort of the areas, how many areas, and then we can usually let you know what we can do for you.
Okay. To everyone watching, if you want to contact Dr. Uju Rapu, Instagram handle is BELFIORE_medical. It's on the pinned comments. You'll see it on the screen right now at the bottom. So just take note of it. After our discussion here today, if you want to get in touch with her, just send her a direct message. She'll be very happy to help you. Okay, well, moving on to the next question. How do you take care of wrinkles in men?
So wrinkles, I always like to talk about what causes something, because I find if you don't know what's causing it, you won't know how to stop it. If I describe the skin like a piece of paper. If you're constantly folding a piece of paper, you see it has a line.
Okay.
So the most common place people have wrinkles are here and here. Facial expressions. So someone that's frowning all the time, you see that you're constantly making this line come up, and you find with time there's a line there or here as well. Yeah. So I try to be conscious of facial expressions to prevent it getting worse. The second thing, we know that the sun's rays speed up aging of the skin. Wrinkles are a sign of aging skin. So people that have more prone to wrinkles, collagen is being broken down in the skin faster. Collagen tightens the skin. If you suddenly take that away, you find the skin is more prone to breaks and lines. So a sunscreen will prevent your wrinkles getting worse. And then in terms of treatments, it depends on the stage of the wrinkle. So some people have really fine lines. You can see they're starting to show, but they're not really a wrinkle yet. So I say get on good skincare quickly to prevent it getting worse. Sunscreen, some chemical peel products we find are constantly, chemical peels are a solution that we apply to the skin to get the skin to regenerate a bit faster. So if you were getting the skin to basically start healing itself, it's basically regenerating, and you find that the lines are improving. So these are things to help prevent it getting worse. Corrective treatment for wrinkles is Botox injections, which we do as well. So Botox is it's a protein. We inject it into the muscle. So we know it's the muscle that's pulling the skin together. We inject Botox into the muscles in the face, and what it does, it just relaxes the muscle, meaning that you're going around, you're frowning, but it's not moving. So you find that it's preventing it getting worse. But I'd just say, if you go out and you're squinting, wear sunglasses. So you want to make sure you're not constantly doing things that will make the lines get worse. And then good skincare practices, because we know that bad skincare can make you more prone to aging.
Yeah, okay. Thank you very much, Dr. Uju. BEA9132, best treatment for KP. I don't understand what that means, but Dr. Uju, do you understand what KP means?
Do you mean keratosis pilaris?
I don't even know what it means. But
can you write out what you mean?
9132, please, if you could just type in the meaning of KP, then we'll be able to answer your question better, please. Then Dr. Jenny, okay, last question from me. What is the best way to deal with stretch marks post-weight loss?
Stretch marks are basically a tear in the skin. Why would the skin tear? Two things. The first is obviously sudden weight gain, or anything that suddenly stretches the skin. So sudden weight loss, sudden weight gain, or losing weight suddenly, or pregnancy or something, in which case it's already torn already. Second cause would be using a lot of mixed creams or some products that have steroids in them, thin the skin out, making the skin more fragile and more likely to tear. How do we treat? We find that there's a lot of products that say they're treating stretch marks, but they never really work as well. We can phase stretch marks out with a procedure called microneedling, which we do at my clinic, my practice as well. Microneedling basically involves us, we numb the skin and then we roll little needles over the skin. What happens is that your skin suddenly feels like it's been injured, so it's prompted to begin healing itself again. Every time skin heals itself, it produces collagen. So collagen tightens the skin, like I mentioned. So we prompt the skin to start healing naturally. Then you're on products. If you go on like vitamin C tablets, vitamin C gets the body to heal itself nicely. Vitamin E products, vitamins help the body heal. So as the skin is healing and producing new collagen, it is tightening and getting a little bit better. But we can never tell you, we can't tell you if stretch marks are going to completely disappear, but we can usually fade them considerably.
Okay. Thank you so much, Dr. Uju. There's so many questions. Like, people are just tuning in. Actually, to everyone that
People are just coming on now.
Because of Big Brother, nobody can compete with Big Brother Nigeria. So I had to let everybody get time to enjoy the show before we started. So okay, we'll move on to the next question from Bibita. How to get rid of forehead wrinkle? Thanks for your time. Hope we see you more often. Yeah, I think you've talked about that, the forehead wrinkle.
Yeah, I talked about wrinkles, yeah.
Okay. She said, stop wrinkling, stop squeezing your face, stop frowning, wear sunglasses, use sunscreen, and if it gets so bad, you can try Botox. I hope that is that okay? I think that's what I got from that. Somebody said something.
Yes.
I think I really need to talk about this person. This is before I think I'll take it in turn. Alia TENN. Do you like mosquito? Is that the only thing you think we know in Africa? Mosquito. Well, why mosquito? So please. Now to Dr. Unjoku Raymond. Enlighten us more on the treatment options for severe acne vulgaris, favorable for both male and female. Lay out your options and prices.
Okay, acne vulgaris, I would tell you when you come and get off dairy products, we find it helps a lot. So stop using stop milk products. The reason being that, okay, you're a doctor as well. We know that acne, there's a lot of hormonal fluctuations that can make acne worse. A cow produces milk when it has a baby. So a cow is a mammal. When a cow has a baby, it has hormonal changes as well. Produces more of a particular hormone, progesterone, which is not that the farmers are injecting the cows with hormones, but then this hormone that the cow suddenly has in its body at a high amount goes into the milk. We drink it. Not everybody who drinks milk will get acne, but in people that are prone, that particular hormone gets the body to produce more of a hormone called testosterone, which is linked to our skin producing more oil and blocking the pores. So if we take away dairy products, a lot of people, I say do a 30-day elimination test. Stop milk, cheese, yogurt, ice cream for 30 days. You normally see improvement already. Certain things we know make acne worse. Stress. When the body is stressed, cortisol levels increase. Any hormonal change can make breakouts worse. So I always ask, something stressful happened. So have you been through menopause, your period? In which case, something hormonal, it would usually settle. Some other things that make acne worse, oily products on the face. So someone that has oily, because most people that have acne have oily skin already. Putting coconut oil, putting shea butter on your face, they can possibly make it worse. I say stop. Funny enough, toners sometimes make acne worse in some people. So a lot of people like using toners. Okay, my face is dirty, throw away. Keep cleaning, throw away. Your skin is supposed to produce a certain level of oil. Some toners, especially the strong, astringent, alcoholic ones, would actually take off so much oil that your skin feels, you have taken away all my oil, let me produce more, and suddenly produces more. And you find some people break out more when they're using strong alcoholic toners. So I just tell you, you don't need to. Before your face is dirty, wash your face 3 times with face wash. Those are the things I would say we should take away in terms of what can be aggravating my acne. Treatment is now usually at keeping the pores unclogged, which you are doing with regular face washing twice a day, regular exfoliation, which you're doing with either a scrub about 2 to 3 times a week, or I put you on some products that I can exfoliate. Treatment for acne is usually antibiotics, which I normally start with topical products. I don't feel I need to give everybody tablets, but over 90% of people will respond nicely to just good products. So I have acne range products that I recommend, and they have antibiotics in them because we know we're treating acne. Some people put people on antibiotic tablets. I don't jump into that, but that's an option. The products usually have a bit of Retin A, usually helps. So Retin A, you can get pure Retin A from a pharmacy, or my acne products have a range, including Retin A. Retin A is a vitamin A. What it does is that it basically lifts dead cells off the skin. So we know dead cells can also clog pores. So Retin A basically tells the dead cells, come off, come off, come off. So products with Retin A would help. Products with salicylic acid, a nice family of acids called the beta hydroxy acids. Their job is basically to keep dead cells off. So there's a lot of emphasis to keeping the pores unclogged, because once a pore gets clogged, the acne process has started already. So treatment is topical products, that include sometimes oral antibiotics, sometimes oral anti-androgens, which I would put you on. So I normally say if acne is very bad, go to a skin doctor. Go for a consultation just to make sure. Medical conditions can make acne worse as well. Polycystic ovaries. So I normally like to talk to somebody one-on-one first.
All right. I think there's a little problem with the video, but thank you so much for your answers, Dr. Uju. We're going to I'm going to read some more questions for Dr. Aliyah Whiten. Sorry, there's not Aliyah Whiten. Where are you? Well, we're both in different places. You know, social media can connect people from all over the world. She's in another location and I'm in another place, but we're having this discussion. So, okay, Bowo A, love Dr. Uju. Yes, we love you. Thank you so much, Dr. Uju, for coming on.
Love you too.
Aliyah Whiten, yes, Botox. Aliyah Whiten. Well, you know, this thing is just making me laugh because when we see all these people that come on your page to just drop this kind of funny things, you just have to.
Yeah, I don't. It's a bit of some spam sometimes.
So there's BA9132. He has explained what he meant, which you said earlier, keratosis pilaris. So I think he asked, what is the treatment?
Okay.
Yeah, I'm going to go back.
So there's no
best treatment.
Yeah, there's no. A keratosis pilaris is a very common condition. The skin is rough and it's a bit bumpy. There's no actual cure, but we manage it with the products you're using. So we want to do lots of nice moisturizing. Thick moisturizers that are good for dry skin are very good. So some products for very dry skin have a bit of urea. Usually products that have a small percentage of urea tend to help. You need to do like lots of nice exfoliations, keep up dead cells. So there's no way to cure it, but we can usually manage it with frequent moisturizing. Even the products you're using to wash, you don't want to dry out the skin basically because dryness makes it worse. So we have soap-free alternatives. Most bar soaps, funny enough, actually dry out the skin a bit more, which a normal person is okay. But if you have a condition you're trying to manage, so soap alternatives. We have bath oils, products that don't have detergent in them, so they don't come out as soapy, but they moisturize the skin at the same time. So we need to keep the skin nice and moist. As soon as you come out, don't dry completely, just moisturize immediately. Frequent moisturizing, and if you have access to products for very dry skin, which most skin doctors would have access to and can prescribe for you, things with a little bit of urea usually helps. So it's really just managing the condition.
Okay. So everyone that's been typing questions, I have to say thank you so much. I actually have a lot of questions, but I've ended up asking just like 2 or 3. So thank you for keeping this program running for so long with all your questions. Elsie and Y said, how do I get rid of dark spots and acne on the face?
So we stop what's causing it. So like I said about acne, go for a consultation, change lifestyle, go on good acne products. Black spots are also known as hyperpigmentation. There's 3 main causes of hyperpigmentation in black people. If I tell you what causes it, then we can probably find out some things you're doing are making it worse. The first is trauma. Anyone picking at their face, just look at the rest of the skin. So any traumatizing of black skin can cause pigmentation. So if you're picking at your skin, it's a good idea to be conscious of not doing that. It will usually make it worse. The second thing that causes blackness in skin is the sun's rays. So going on a sunscreen as well will prevent it getting worse. Third thing that causes black spots is inflammation in the skin. So acne is a form of inflammation. So if you're always having acne, some people are not even picking it and they find it's getting dark. So we stop the acne. So I tend to treat acne first before treating black spots because I know acne is a cause of black spots. So I make sure we're not breaking out again. Then in terms of treating black spots, we exfoliate the skin, but with more aggressive exfoliation. So I do a lot of chemical peels. It's a procedure where we apply solution to the face to cause layers of the skin to just shed. You find as these layers are shedding, new skin is coming under, faded, and when you're not breaking out anymore, we can usually maintain that. The chemical peels, be cautious of who does chemical peels on you because there's always a risk with all cosmetic treatments. You want to make sure the person is trained and has been doing, trained and used to doing peels on skin of color if you are a dark skin person. So we're just careful with that. But I do chemical peels to treat black spots. You can use with products as well. They take a little bit longer. But we just basically want to exfoliate the skin and get the skin to produce new layers without the spots.
Okay, Dr. Uju, let me just say something to Elsie and why. What like for people, maybe she wants to do something at home, what would you recommend, like in terms of fruits,
For black spots,
remedies?
and most important thing is to stop them coming out. So stop picking your face, and then we control the acne. Skin tends to exfoliate itself naturally, so you find that if you've stopped what's causing it, you're not picking at it, it will start to fade over a period of time, a little bit longer if you're not using anything. The products that will speed it up, because a lot of we really use lightening products to treat hyperpigmentation, but I'm a bit cautious because you say you're doing it at home, because people using lightening products, we like to monitor your use to make sure you're using it safely. So I won't just give somebody hydroquinone to go and use in their house. So I would tend to treat with lightening products for a period of time, or the treatment, such as the chemical peels, or products that have a little bit of chemical peels. So they have some products that have a bit of glycolic acid, lactic acid in really tiny doses on the shelf. They're using them at night. You find that, or even things like retin A. Remember I mentioned retin A takes dead cells off. So retin A is a form of exfoliation. So that's a nice secret you get from the pharmacy. Ask for retin A 0.05. Okay. Retin A makes your skin more sensitive to the sun, so use in the nighttime only, but it will fade with time.
All right. Okay. This is our last question from Dr. Njoku Raymond. A lot of us don't know what type of creams to use, especially men. Enlighten us of some products in the market that you will recommend.
The basics you need to be on a face wash. So I say something that says for the face, a face wash, and you go to a pharmacy, they have products, men's face wash, and a sunscreen. I find sunscreen very important. Not everybody will use a sunscreen, but people that are concerned about wrinkles, pigmentation, use a sunscreen. If you're not going to use a sunscreen, a nice moisturizer is okay. Products on the market, I normally tell you, look for a brand that has been there for a long time. So personally, I prefer
Please go on.
A brand that you know, tried and tested, and it has been on the market for 30 years or more. So I don't like unbranded products. So if I can't see what is in it, I won't recommend it to you.
Sorry, cut you now, because we just have like 1 minute 46 seconds left. So can you just quickly list the brands? Okay. And close up now.
List the brands.
Yes. Like, to me, I like Neutrogena a lot. Like, if
Neutrogena, Clarins, Simple, Olay, number 7. You can even just Google it while you're there. Just make sure it's something that it looks like a legit product, and you can use this moisturizer, sunscreen, face wash. That's your basic.
Like, stick to Neutrogena. I've used it for so many years. I've tried many products, but I stuck to Neutrogena at the end of it all. So just go for the.
And then just clear the commitment, consistency. If you're still having problems, you can come. I can also recommend some prescription products.
Yes.
So products I have are a bit more.
Yes. Thank you so much, Dr. Uju. I really, 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 really appreciate you taking your time to do this.
You're welcome.
Watching. We'll be going now. Instagram live video has a limit. So remember, till the next time we meet, always be brave enough to start a conversation that matters. We love you. Mwah. Bye. So Neutrogena, bye. Thank you so much. I'm so grateful. Bye.
Neutrogena is paying you. Bye.